Hello friends. Welcome back to the channel. Ovarian cancer is known as the silent killer because its early symptoms are often overlooked. However, knowing the warning signs can make a difference. In this video, we will see 10 typical indicators of ovarian cancer that many people overlook. These symptoms may seem mild at first, but they could be your body's way of communicating something dangerous. Stay with us to learn about the warning signs you should not ignore and how to protect your health. Abdominal bloating. Abdominal bloating is one of the most frequent symptoms of ovarian cancer that many women ignore. This occurs when fluid begins to accumulate in the abdomen, a condition known as ascites, which is usually caused by the spread of cancer cells. Abdominal distension can make the stomach feel tight, full, or considerably larger than usual, as if after a large meal. However, the bloating associated with ovarian cancer persists and can worsen over time, even if you haven't eaten much. Many people assume it is caused by overeating, indigestion, or weight gain, but persistent and uncomfortable bloating is a warning sign. This discomfort may also be accompanied by a feeling of heaviness in the lower abdomen. Since abdominal distension is a symptom of many less serious diseases, it is sometimes overlooked until it worsens. If you have unexplained and persistent bloating that lasts for several weeks, you should see a doctor. Early detection of ovarian cancer increases the likelihood of successful treatment, so recognizing and acting on the symptom is crucial. Pelvic or abdominal pain. Pelvic or abdominal pain that does not seem to have a clear cause can be another early indicator of ovarian cancer. This pain may start out mild, similar to cramps or discomfort in the lower stomach or pelvic area, but it can worsen over time. The pain is usually persistent and can be sharp, dull, or uncomfortable. However, this pain is different from the brief cramps that some women experience during menstruation. The discomfort associated with ovarian cancer does not follow a monthly cycle and tends to worsen as the disease progresses. This pain occurs due to the growth of the tumor and pressure on the abdominal organs, as well as the spread of cancer cells to other tissues. Some women may experience pain in the lower back or thighs as a result of the cancer's effects on the nerves and other pelvic tissues. Unfortunately, since pelvic or abdominal discomfort is common in conditions like irritable bowel syndrome and urinary tract infections, it is often misinterpreted. However, if your discomfort is new, severe, or lasts more than a few weeks, you should seek medical attention. Difficulty eating and feeling full quickly. One of the less obvious symptoms of ovarian cancer is difficulty eating or feeling full quickly after starting a meal. This discomfort arises when the growing tumor presses against the stomach and intestines, limiting the amount of food you can safely consume at one time. You may start eating with hunger but after a few bites feel full or even bloated. This sensation may be accompanied by nausea or pain. Many women may dismiss this symptom, assuming it is caused by changes in diet, stress, or aging. However, if you consistently eat much less than usual and feel satisfied very quickly, you should pay attention. This symptom is especially alarming when combined with unintentional weight loss. The combination of these indicators suggests that the body is trying to communicate that something is wrong. Although many other conditions, such as acid reflux or a stomach ulcer, can produce similar symptoms, if this change in appetite persists, consult a doctor. Frequent or urgent need to urinate. Feeling the need to urinate more frequently or urgently than usual can be a sign of ovarian cancer. This happens because a growing tumor in the ovaries can press on the bladder, reducing its capacity and making you feel full more quickly. You may notice that you go to the bathroom more frequently during the day and perhaps wake up at night to urinate. Sometimes you may have an urgent need to urinate but only expel a small amount of urine. Although more common causes of frequent urination are a urinary tract infection, UTI, or an overactive bladder, it is important to evaluate this symptom in light of other changes in the body. Women often dismiss this indication, especially if they have children or are getting older, because these conditions can also induce changes in urination. However, if you notice a sudden and unexplained increase in the frequency or urgency of urination, especially if accompanied by other symptoms such as pelvic pain or bloating, you should consult a doctor. Unexplained weight loss. Losing weight unintentionally can be a warning sign of ovarian cancer, especially if it occurs rapidly and without apparent cause. This type of weight loss is often associated with a loss of appetite and a sudden feeling of fullness, both common indicators of ovarian cancer. As the cancer progresses, the body begins to use more energy to fight the disease, which can lead to weight loss. Additionally, the spread of cancer cells can alter how the body processes food, leading to a decrease in fat and muscle mass. Many people may be happy to lose weight at first, especially if they have had problems with it before. Still, it is crucial to understand that unexplained weight loss can indicate a significant health problem. If you are losing weight and don't know why, you should consult a doctor, especially if it is more than 5% of your body weight in a short period. Unexplained weight loss, especially when paired with other symptoms such as bloating, pelvic pain, or changes in urination, can be an early warning sign of ovarian cancer and should not be ignored. Fatigue. Fatigue is a common symptom of many diseases, but in the case of ovarian cancer, it can be overwhelming and chronic. This type of fatigue is more than just feeling tired after a long day. It is severe exhaustion that does not go away with rest. You may need to sleep more than usual and still wake up exhausted. Simple actions that were once easy, such as climbing stairs or carrying groceries, may now seem difficult. This fatigue occurs because the body expends a lot of energy fighting cancer and dealing with the physical and emotional stress of the disease. Additionally, ovarian cancer can induce anemia, a decrease in red blood cells, which can contribute to excessive fatigue. Although fatigue can be due to various causes such as lack of sleep, stress, or even other medical conditions like thyroid problems, pay attention if your exhaustion is severe, persistent, and does not improve with rest. Lower back pain. Lower back pain can indicate ovarian cancer. This discomfort is usually persistent and does not seem to have a clear explanation, such as a recent injury or strain. The discomfort is often caused by a malignant tumor that develops and presses on the nerves or other tissues of the back or pelvis. In other cases, the discomfort may be due to the accumulation of fluid in the abdomen, which puts pressure on the spine. Back pain associated with ovarian cancer may start out mild but can worsen and become more intense over time. It is not the same as the occasional back pain that many people experience due to poor posture or sitting for long periods. Since back pain is so common, it is easy to confuse it with something less serious, like a muscle strain or arthritis. However, if the pain is continuous and unexpected, especially if there is no obvious cause, it is worth investigating. Changes in bowel habits. Changes in bowel habits, such as constipation or diarrhea, can occasionally be signs of ovarian cancer. These changes occur when a tumor in the pelvis presses against the intestines, affecting their normal function. You may notice that you have more or fewer bowel movements than usual, or that your stools are firmer or looser than before. Some women may alternate between bouts of constipation and diarrhea. Even after going to the bathroom, you may feel that your bowels are not completely empty. Although bowel habits can be altered by various factors such as diet, stress, or irritable bowel syndrome, pay attention if the changes are new, persistent, and do not seem to have a clear cause. Early detection of ovarian cancer can significantly improve treatment outcomes, so do not dismiss changes in your bowel habits, especially if accompanied by other warning signs. Menstrual changes. Menstrual irregularities can be an early indicator of ovarian cancer, especially in women who have not gone through menopause. These changes may include heavier or lighter periods, irregular cycles, or bleeding between periods. Your periods may have become more painful, or you may experience pelvic discomfort outside of your typical menstrual cycle. Some women may even experience a sudden cessation of their menstrual cycle, which can be particularly problematic if it occurs unexpectedly. These changes occur when the cancer affects the ovaries, which regulate the menstrual cycle. Menstrual changes can be caused by various factors such as stress, weight changes, and the use of contraceptives, but persistent or unusual changes should be treated with caution. Pain during intercourse. Pain during intercourse, often known as dyspareunia, can be an indicator of ovarian cancer. This pain may be felt deep in the pelvis during sexual activity and can range from mild to intense. The pain occurs when the tumor in the ovaries presses against the pelvic organs, such as the vagina and bladder, making intercourse uncomfortable or painful. In some cases, women may feel pain after intercourse or during a pelvic exam. This symptom is sometimes overlooked or misdiagnosed as another cause, such as vaginal dryness or infection, but it is important to pay attention if the discomfort is new, chronic, and does not seem to have an obvious cause. Although many women may experience some discomfort during intercourse, Persistent pain that does not go away should be carefully considered. Recognizing these warning signs early can save a life, so do not ignore them. If you found this video useful, please give it a thumbs up and share it with someone who needs to hear it. Early detection is crucial for receiving more health tips and vital information. Subscribe and turn on notifications so you don't miss our next videos. Stay informed, take care of your health, and see you in the next video.